Hi, everyone. This is Jen at CapNix Drive. Thank you so much for joining us for our June webinar. Today's topic is children's mental health, and so we will dive right in. What is mental health for children and mental health in general? It's really no different for kids than it would be for us as adults. Mental health includes our emotional, psychological, and social well-being. It affects how we think, feel, and act, and it also helps determine how we handle stress, how we relate to others, and it impacts the choices that we're making, whether they're healthy choices or less healthy. Mental health is an important aspect of our well-being, and it's important at every stage of our life, from childhood and adolescence through adulthood. So if a child has a fever or a persistent cough, we react. As caregivers and parents, we pay attention and reach out for help. But sometimes if a child seems sad or irritable or not interested in activities, we can think of it as a phase, or maybe we even see it as teenage angst, or just something else to be ignored. However, being mentally healthy during childhood means that you're reaching developmental and emotional milestones and learning healthy social skills and how to cope with stress and problems. And so as caregivers, it's important that we are paying attention to those, our children's mental health, just as we would their physical health. Why? Mentally healthy children have a positive quality of life and can function well at home, school, and in their communities. Now, don't get me wrong, I have 2 young kids. Tantrums, bad days, and negative feelings and emotions are all part of a normal childhood, even in children with no mental conditions. It's when those certain symptoms become disruptive to that child's development or to that child's quality of life that we need to start taking a closer look. Children can experience many of the same health conditions as adults. It's just that their symptoms may differ, and that's something that we'll touch on in the next slide. So mental disorders among children are described as serious changes in the way that children typically learn, behave, or handle their emotions, and that can cause distress and problems getting through the day. Some of the most common mental health disorders found in children are things, again, that you would see from adults with mental health conditions as well. So anxiety, depression, ADD or ADHD, oppositional defiant or obsessive compulsive disorder, conduct disorder, post-traumatic stress, and Tourette's. So we're not going to go through those clinically, but we'll be discussing some of the common symptoms and things to look out for when it comes to these conditions in children. Symptoms of mental disorders change over time as a child grows, and it might be difficult, it might include difficulties with how that child plays, learns, how they speak or act, and how that child handles their emotions. Symptoms often start in early childhood, although some disorders may develop during the teenage years. Diagnosis is usually made in school years, sometimes earlier, and some children with mental disorders may not be recognized or diagnosed at all. So here are some things to look out for and some of the general, most common signs and symptoms of poor mental health that could present a need for treatment or further exploration. Frequent tantrums and/or intense irritability. Sleep problems, social isolation, struggling academically, low energy, complaints of stomach ache or headache, but no identifiable causes. Often we see that in kids who are anxious or worried, that they don't have the language or the tools to really explain that. And so it comes across in physical symptoms like a stomach ache. Older children, you might see them engaging in risky behaviors such as drug and alcohol use. And again, because our kids don't always have the tools to clearly communicate what they're feeling, it may come across and be expressed in a way that's different than what we as adults experience. There's no single cause of a mental health condition and no way to 100% prevent one either. Mental health is really determined by a number of factors working together, and that includes your genetics, environmental factors, your social support and relationships, and your life experiences. So when we think about our biology and our genetics, this is our family history of mental health disorders. Is there a genetic mutation that would make a child more susceptible to a mental health disorder? Imbalances in brain chemistry or hormone imbalances, like you might see in a child with thyroid condition. Community and school risk factors include being bullied, pressure from that academic environment, lack of social support, socioeconomic disadvantages, lack of mental health resources. You can even see cultural expectations influencing mental health, along with societal norms, stigmas, things that our kids are definitely experiencing in that environment. When it comes to family and peers, if we are struggling with a mental health problem such as depression, anxiety, or substance abuse, it can impact our child's well-being. So if you as a caregiver are having some struggles, it is going to have an impact on your child as well. The conditions can affect how we're parenting, our abilities, family dynamics, overall emotional climate within our home, the pressure to conform to negative behaviors can also contribute to emotional behavioral difficulties. And then lastly, when you look at life experiences, the past several years has served as an example of the impact of major life experiences on mental health. I think we can all attest to, during the COVID-19 pandemic, the prevalence of mental health conditions among both children and adults increasing dramatically as we all learned to manage our lives in a totally different way, right? There were school closures, social distancing measures, restrictions, etc. Do I keep clicking the wrong button, guys? Let's keep moving it back. I'm click happy. Let me go to show all. Sorry about that. Usually they don't let me do two things at one time, like talk and click.
All right, we're back on track.
Good, just in time for me to move on to the next slide. Other lifestyle experiences could include children that are living in low-income communities, ethnic minorities or oppressed populations, immigration status, physical, developmental, and intellectual disabilities, or chronic medical conditions. Especially traumatic experiences can be classified as a ACE, adverse childhood experience. And we're going to take a look at that next. And I'm going to click one time. So ACEs, or adverse childhood experiences. These can include children who are experiencing or witness a distressing event, natural disasters, accidents, physical or sexual abuse, neglect, domestic or community violence, household dysfunction, loss of a loved one, serious accidents, etc. children who do experience these ACEs are at a higher risk of developing mental health issues. Adverse childhood experiences are potentially traumatic events, and they would be occurring in those first 17, 18 years of life. So it also is going to include aspects of your child's environment. It can be things that are undermining their sense of safety and stability and bonding, growing up in a house with substance abuse problems, for example, instability due to parental separation, or maybe a household member being in jail or prison. The examples are not a complete list. This is just a quick look. So keep in mind that there are other categories and examples of adverse childhood experiences. And again, those ACEs are linked to chronic health problems, mental illness, and substance problems in adolescence and adulthood. So we want to limit the ACEs because they can so negatively impact our children, not just as they are kids, but as they continue to grow and evolve. Creating and sustaining safe, stable, nurturing relationships and environments for all children and families can prevent ACEs from coming about and help children reach their full potential. So that can be something where we are connecting with our youth and showing interest in their activities and providing economic supports, educational supports, promoting social norms, and preventing and protecting against violence and adversity. So how many children are affected by mental health and a mental health condition each year? In 2019, the U.S. Department of Health and Human Services found that at least 1 in 5 U.S. children ages 3 to 17 has a mental, emotional, behavioral, or developmental disorder. Let's do some more exploration. What percentage of children who need mental health services receive appropriate help from mental health professionals? So of those 1 in 5 who need the assistance, who is getting help? Only 20% of the children who need mental health services receive appropriate care. And so that's why this topic is so important. We want you to have the knowledge and resources to offer support and care to the children in your life. And here's what you can do.
Yeah, thank you. So now that we know a little bit more about the prevalence of mental health conditions in children and about the symptoms and how to, keep an eye out for these kinds of things, let's talk about what we can do to mitigate risk, especially within our own families and within our own communities. So we have these recommendations on the slide, including creating rituals of communication, safe spaces, encouraging healthy media habits. But we can also talk about creating a support system of family, peers, teachers, coaches, other adults in your child's life. So the people surrounding youth influence their behavior directly and indirectly. Each child needs a team of actively involved adults at home, school, and within the community, leading by example and encouraging their success. Similarly, encouraging friendships with peers who demonstrate positive habits and good decision-making skills can provide a sense of connectivity and beneficial peer pressure. We also want to encourage academic achievement and aspirations. So not every student is destined to be a valedictorian, but every student can give their best effort and explore their interests. Encourage and recognize these efforts, but be conscious of struggles and work with educators to find additional support when needed. Talk about the future and impress upon your child, many careers require further training through college, trade school, other forms of advanced education. we don't want to put too much pressure on our kids. We've talked about that being a factor that can negatively affect their mental health, but we do want to talk to them about setting academic goals, and we want to be able to equip them with the tools necessary to achieve them, so they don't feel crushed by the academic pressure, but rather that it's something achievable. We also, to mitigate risk for mental health conditions, we want to set clear expectations for behaviors and values. So it's natural to test limits, but kids do need clear boundaries. So consistently communicating those expectations for behaviors and values sets that bar for your child and demonstrates your care and your commitment to their success and to their well-being. We also want to be teaching coping and problem-solving skills. So how your child responds and navigates life challenges is as important as the outcome. So teaching your child how to accept disappointment, navigate conflict, and be solution-oriented in the face of adversity can serve them throughout their life. This is part of making your home a judgment-free safe haven, creating those rituals of communication, and kind of leading by example. And lastly, pay attention to your own mental health. If you do have a child who's experiencing, symptoms of a mental health condition or has a diagnosed mental health condition, it can be particularly draining. And we're going to be talking a little bit about a resource for parents and family in a few slides. But just make sure to take care of yourself during that process as well. Now, looking at treatment, so like mental health conditions, like the mental health conditions between children and adults are similar, treatment options are similar as well. So treatment can include therapy. This might involve, meeting with a mental health professional to discuss and work through those emotional and behavioral difficulties. Different types of therapy, such as cognitive behavioral therapy, play therapy, family therapy, individual, group, art, there's all kinds of therapies, especially for children, can be utilized based on your child's needs. Treatment may also include providing supportive interventions that aim to create a nurturing and supportive environment for the child. So this can involve providing emotional support, building resilience, fostering healthy relationships, and implementing strategies to manage stress and promote well-being. It may also include parent training and behavior management, in which a therapist works with parents to learn or improve skills to manage their child's behavior. There's also school-based interventions. These may include counseling services, behavior management plans, social emotional learning programs, and accommodations to address educational needs. Treatment may also include medication, but this is something you should always discuss with your child's healthcare provider. And as an important note, if you observe any indications of declining mental health or developmental challenges in your child, reach out to their primary care provider. They will be able to work with you and your child to, if necessary, diagnose a medical condition, provide referrals, and create a treatment plan. So there are several methods of finding mental health support for your child. First and foremost, as I just said, talk to your child's primary care provider and see if they have any referrals or any resources that you can utilize. You can also utilize your EAP if you have one. So employee assistance programs offer free and confidential assessments, short-term counseling, referrals, and follow-up services, not only to employees, but to their families as well, who are experiencing personal and or mental health conditions. The first time when I was an undergraduate and I experienced my first, kind of like mental health crisis, I reached out to my mom and she said, "Oh, I have this EAP program." And so that was actually how I accessed therapy for the first time, was through an EAP program. So reach out to your HR department if you're unsure if you have an EAP or if you have questions about utilizing it. Next, we have support for parents and loved ones. So NAMI, which is the National Alliance on Mental Illness, has tons of resources and offers nationwide free local support groups. So though they don't offer support groups specifically for children, they do offer family support groups, which are peer-led support groups for any adult with a loved one who has experienced symptoms of a mental health condition. So those groups are full of families and parents who are all supporting and loving someone with a mental health condition. So this is a great way to support yourself while supporting a loved one. And if you scan the QR code next to it, it will take you right to a website where you can find more information. And then lastly, for finding support, Psychology Today has a great search tool for finding local providers, from therapists to psychiatrists to treatment centers and support groups. You can filter by insurance type, distance, specialty, and more. It's a great resource for finding mental health care based on what you or your child may need. Now on this slide, we just have 2 reflection questions. Just to ask yourself, after watching this presentation, and those 2 questions are, how can you use this information to support the children in your life? And what do you wish that you understood about mental health as a child? We're not going to spend too much time on this slide, but if you would like to either take a picture of the slide or write down these questions, just something to absorb and reflect on as we move through our day. And then lastly, we have some further education. So if this is a topic that you are interested in and you would like to learn more, there's a wonderful TED Talk on how families can support a child's mental health. If you would like to watch that, you can go ahead and scan the QR code and you will be taken to that video. There's another podcast called Scrambled, which is the Children's Mental Health Podcast. And this podcast just works to normalize those conversations around children's mental health by providing accurate, helpful information, especially regarding anxiety, depression, and trauma in childhood. The bottom 2 resources are great for kind of explaining emotions and mental health to children. So When Sadness Comes to Call is a children's book that explores experiencing sadness, and it also just offers insights to coping and to navigating those emotions. And then I'm sure many attendees or many viewers have already seen this, but the Disney movie Inside Out portrays the inner workings of a child's mind, and it highlights the importance of acknowledging and understanding emotions in order to achieve mental well-being. So both great resources for connecting kids with an understanding about their own mental health. And that is all we have on children's mental health. Thank you very much for joining us today. Next month, we will be here covering hearing loss and ear safety. That will be from July 26th, or that will be on July 26th from noon to 12:30 p.m. Eastern Standard Time. If you are interested in viewing that webinar, you can go ahead and scan that QR code to register. And with that, we leave you. Thank you very much for joining today, and we hope to see you next time.